Dr. Tracy, board certified general pediatrician, and I wanted to do a quick talk about something that's going around right now, especially up in the Northeast, but all over the country, is enterovirus. So E-N-T-E-R-O. Enterovirus is a summertime virus mostly that can mimic a few other viruses, and we're seeing a bunch of it in clinic right now, so I figured it would be helpful to talk about. It is spread the same way all viruses are spread, usually upper respiratory droplets, but the difference with enterovirus is that it also has a GI component, so it can give you vomiting and diarrhea as well. Therefore, it can be spread by bodily fluid. So what are the signs and what are the things you should be worried about? Common signs in most people is a combination of a fever, sore throat, stomach issues, as well as a rash. That's kind of the classic enterovirus. If you have all of them, it's kind of easy to determine what it is. Sometimes people only have one or two of these symptoms. So how do you know this is what it is in your child? First of all, it's not always very clear. So if you're not sure, call your pediatrician. We're happy to help you through. Reasons to give us a call is if the fever's lasting for more than 3 days, if the child is not able to eat and drink, if you have concerns of another issue, or if your child is immune compromised or unvaccinated. But here's what it looks like. It looks like these white kind of like pus pockets in the back of the throat. It can be very painful, but it's not near as red as strep. So strep is very red, think like beefy raw meat, and it sometimes has little broken blood vessels around it. Typically, strep does not have white pus pockets. Is that always the case? No, but typically it looks a little bit different. So this is hard to tell this time of year, so we typically do a strep test just to make sure. But in the first few days, just kind of monitor and see how your child is doing, keeping them away from others, having them wash their hands, reassurance with Tylenol, ibuprofen, lots to drink, rest, all of those things. So how can enterovirus be dangerous? It can be dangerous in babies. So enterovirus is a common cause of viral meningitis in babies. And so obviously this is another reason not to kiss other people's babies. And if you have a school-age child or you have any signs of that you might be sick yourself, stay away from a newborn. A newborn parent might notice just either fever, lethargy, not feeding well. It's not always obvious in the beginning, so always call us with any symptoms for a newborn. So remember, enterovirus, fever, white pockets in the back of the throat, rash on the trunk that's kind of splotchy looking, sometimes with vomiting and diarrhea as well. Not a ton of upper respiratory symptoms, but they can have them, especially in school-aged kids. It's self-limited, it gets better on its own, it can be confused with strep. So if you have any questions, call your pediatrician. Stay well, wash your hands. Take care.